Namaste. Let's take another case of Sialadenitis. I am presenting this case. See, you have to learn homeopathy practically. You should know how the symptoms are being given by the patients. You cannot repertorize any case unless you know your materia medica and the evolution of the disease. Homeopathic cases should be presented like this. Whoever is presenting cases, whoever is teaching homeopathy, they should present the cases. Okay, so here is the case of Sialadenitis. This is a 16-year-old girl, as you can see in the video, a 16-year-old girl complaining of recurrent. कहाँ है बेटा बताओ? हाँ ये है ना? इधर पे है? अच्छा, इधर दिखाओ. इधर भी है? कहाँ से कहाँ तक मालूम पड़ता है? बताओ अपने हाथ से, उंगली से बताओ. बॉर्डर
यहाँ से यहाँ तक.
हाँ.
और इसमें यहाँ से यहाँ तक.
अच्छा.
और यहाँ पे जहाँ दर्द होता है.
यहाँ दर्द होता है? और कहाँ दर्द होता है?
और इस साइड यहाँ.
अच्छा, कान के नीचे दर्द करता है?
हाँ.
कब से है तुमको तकलीफ?
कम से कम 6-7 महीने हुए. दवाई हो रहा था तो आराम नहीं हुआ.
किस चीज़ का दवा हो रहा था?
एक बार थायराइड का जांच हुआ तो
हाँ.
निकला था.
ठीक. Pain every 15 days to 7 days. She gets pain in the submandibular region with a swelling. Now the patient is coming to me with these symptoms. Initially it started on the right side and then it went to the left side. You should always know, whenever you are looking at a case, you should know how did the problem start. So the first question you should ask, since when are you having this problem? A person is well, a person is doing well and suddenly he falls sick. So the first thing you should ask the patient, you should try to analyze why the patient got sick. Now this patient has come to me. I will show you the entire audio case and the video. This patient, they don't know anything. They are laymen. They are only concerned about their problem. If you are going to repertorize the case by the symptoms which is given by the patient, you will never arrive at your remedy. Now this 16 years girl, she is having this problem since January. She consulted me in October. So it has been nearly 10 months. January means what? It is winter time. So she first started her complaint in January. Suddenly she got pain in the submandibular region with a huge swelling, and she was having, as soon as she was eating the food, she was getting what? Severe pain. Now she has come to me after 10 months. So I tried to ask her, how did the case evolve? So she started the complaints in January, and then she went to the local doctor. The doctor, gave her medicines. They might have given her antibiotic or something like that, and she didn't get any response. After that, she went to the ENT. Now the ENT did the investigation, and as you can see in the report, she is suffering from what? Focal. They have given, the investigation report shows that she is suffering from focal Sialadenitis. Now Sialadenitis is the inflammation of the salivary glands. Most of the times it is the parotid. Most of the time, but other glands like the submaxillary and the submandibular can also get involved. In this case, she is having the problem in the submandibular gland. Now, when I take the history, first of all, what I get, now she went to the ENT. The ENT told her that, he will cure it in 1 month, and the girl didn't get relief. The problem went on increasing. the intensity and the time period went on increasing. So she consulted what? A homeopathic doctor. Now you can imagine what is the level of the clinical knowledge of homeopathic doctors, or he might be a quack. This person did here is the swelling, and this guy, he did what? Investigation for the thyroid, and he put her on what? Anti-thyroid pills. Where is the thyroid? Where is the submandibular? Is there any sense? Is there any sense in doing all this nonsense? And the girl was put on what? Thyroid pills. Now it has been 10 months and she has come to me. So as I was telling you, when I investigated the case, before that, January she started this complaint. Before that, in the previous year, that is in September and October, doctors gave her medicines for what? Typhoid. The girl is telling that last year, previous to this complaint, last year she was given treatment for typhoid fever twice, once in March and once in September and October. Here what happens, any person having little bit fever or body ache, all the lab investigation in my 10 years or 12 years of practice in this village, whoever patient comes to me, he comes to with what? Vidal positive. So they put you on 21 days of medicine. So this girl was given what? Treatment for typhoid previously 2 times. So, which was also wrong. Giving of, she was just having what? Malaise, body ache. It can happen to anybody. Everything doesn't require a medicine. Please understand that. Everything doesn't require a medicine. Things can be, you should, as far as I am concerned, I try to give minimum medicine to the person. So here in this case, what has happened, she was given lots of antibiotic, then thyroid, but her chief complaint, that is what? The Sialadenitis, it remains the same and it goes on increasing. She gets pain as soon as she swallows anything. You can see in the audio, she gets the pain when she's spitting also. So, just within 1 month of treatment, you can see the follow-up video. I have given her what? Total relief. दवा गई है 21/10 को गई है, उसके बाद से कैसी हो? 1 महीना लगभग हो गया ना, तो कितने बार सूजन आया? क्या आया?
कुछ नहीं हुआ, बस एक बार उभार हुआ था।
एक ही बार खाली उभार हुआ था? कितना उभार हुआ था?
वो यहाँ पे सूज गया था और यहाँ पे,
हाँ,
अंदर यहाँ पे भी जीभ में।
दिखाओ। अच्छा, ये छाला आया है ऐसा? 2 दिन तक था?
पहले दिन ज्यादा था, फिर उसके बाद बहुत कम।
अच्छा, और पहले जब ऐसा होता था तो क्या होता था?
तब यहाँ पे ऐसे सूजन हो जाता था। हाँ। फिर यहाँ ये जो जीभ वाला है, हाँ, ये वाला और ज्यादा मतलब सूज जाता था जी।
ये तो पिछली बार जब आए थे तो नहीं बताए थे तुम?
हाँ, तब वो एक बार ही हुआ था, हाँ, ऐसे ही हुआ, छाला वाला हुआ।
अच्छा अच्छा,
तो इसीलिए मैं नहीं बताया।
तो पहले भी ऐसा एक बार हुआ है तुमको? हाँ। अभी फिर से हो गया ऐसा? हाँ। अच्छा, so, and along with the relief, in the second video, you will find that she has got what? A small vesicle, pustular vesicle under the tongue. On inquiry, she gave the history that whenever she used to have the pain, she used to get this what? Eruption like this. Earlier, it was bigger, and this time it is what? Smaller. I had given her, they come from far away, 60 to 70 kilometers away. So I gave her medicine for 1 month. And after 1 month, you can see that her complaints are, she got the attack only once and the intensity was very less with reversal of symptoms. Homeopathy is not only confined to repertorizing the case. Magic doesn't happen in homeopathy. You should know what happens after the remedy is given. I haven't seen people only teach what? Repertory and rubrics. What is the use of the repertory and rubric? People who are teaching homeopathy, they should, should teach everything. After the medicine has been given, magic doesn't happen. Okay, there will be aggravation. I have, they present cases, and I haven't seen any person, showing the rules, showing the reversal of the symptoms. In all my cases, I get what? Reversals. You should know what has happened after you have given the remedy to the patient. So here, this patient, in the next month, she will be completely all right. I can say that because, old symptoms, old problems have resurfaced with amelioration of the patients. So you can have a look. If you are interested in learning homeopathy, live homeopathy, you cannot come to the rubrics, it is all fake. People who give the rubrics, they should not give me the rubrics. If you want to teach homeopathy, you should tell me the conversation. What did the patient tell you? And how did you infer that this is a rubric? This particular thing is a rubric. So you should learn homeopathy. You should learn homeopathy because the presentation by the patient is totally different. So you can learn the classical homeopathy, single remedy homeopathy. You have to learn like that. Homeopathy is a super science. It has just been destroyed by what? The quacks. You should have clinical knowledge. You should know what is Sialadenitis. What are the causes? So, have a look at this case of Sialadenitis, the follow-up after 1 month, and how the patient is complaining.
आइए इतना सा पहले तो यहाँ से यहाँ ले रहा है ना। अब कहाँ है? खाली यहीं बा एक जगह उतना रहा है ठीक है। और यहाँ ना बा कुछ यहाँ भी बा। अरे वैसे रहे ना तो तकलीफ थोड़ी है कोनो, कुछ तकलीफ ना है ना घुटने उठने में पहले जैसे उतरे ना है ना। ठीक है।